musculomembranous structures, and it causes a lot of folding inside, and it has a tremendous stretchable membrane with the muscle fiber, and the muscle can causes spasm inside, squeezing, relaxing, squeezing, relaxing, and the tremendous amount of what is this called, expandile characteristics. That's why during the labor, baby birth, it can go too dilated. And also in the normal condition, the vagina remains collapsed and squeezed. It could be elongated, it could be dilated. This is the property of the extensible tissues that under pressure, under stress, it can be stressed and elongated, and it has receptors to be influenced by the hormones. Okay, so those are very important. Sonographically, we need to know where is the vagina located, how big the length is, what are the layers in the wall, and how does it work, and why it, and how it may affect called infertility. It may affect for sexual activities, and it can have some inflammation, and it can have some polyp, tumor, or Gardner's cyst, and it could be there might be a cyst formation. There are a lot of glandular glands with a duct inside the vagina, and that can be obstructed, and followed by the gland will be infected, and there might be imperforated hymen too. Okay, so if I draw another diagram, then I will show you that how the sonographic appearance of the vagina takes place. Okay. Okay, so this is sonographically, you will see okay, sonographically you will see the vaginal lining is brighter. You will see the vaginal lining is brighter, and the rest of the vagina has the muscle and the outer layer. So this is outer again serous layer, and serous layer is always fibro-connective tissue, and those are always hyperechoic. All fibroelastic connective tissues are hyperechoic, and this is muscular layer, and this muscular is a membranous type that has a power of to be elongated under pressure. Okay, So 3 layers, and this is innermost layer. Mucus layer. And let me show you here. Okay, I'm just showing. Look at here. These are Gardner gland, okay, that turn into cyst. And if it is inflamed, it may turn into abscess and very painful situation. Okay, so now this is a sonographic view. So if I give you the orientation, okay, so then anterior, posterior, superior, inferior. This is the vagina. Vagina is inferior to the body, yes. Okay, and I will show you something else. Okay, so this is bladder. This is bladder, this is uterus, and this is rectum. Okay, so this is rectum, this is posterior cul-de-sac, okay? Posterior cul-de-sac, and this is anterior cul-de-sac between the uterus and the bladder. If there is a fluid over here, it will collect over here. Anterior cul-de-sac. Okay, so now, so this is anterior wall of the vagina, anterior wall, and this is posterior wall of the vagina. Posterior wall usually bigger than the anterior wall. The anterior wall is usually 7.5 centimeter and the posterior wall is 9 centimeter average. Okay, and it produces the cul-de-sac. Sorry, anterior. Okay, it produces a space. Look at here, the posterior wall and the cervix. Okay, and let me say its name. No, it's not here, but I will give you the name. What is the name of this area? But make sure that sonographically you can recognize that area. Posterior area is more capable of collecting any secretion, including the sperm, discharge, semen. Okay? And anterior is smaller than the posterior, this area. And because of this connection, the external os is here and internal os is here. The external os is inside the vagina. Cervix is little protruded inside the vagina. Okay, so any discharge from the cervix, it goes through the external os and into the vagina. And the vagina may collect it or vagina may expel it right way. Okay, so normally this vagina wall is like a corrugated, wavy and in relaxed condition. But when it is expanded and it is no wavy. And it has a tremendous squeezing and expanding nature. And it works during the orgasm, and because of this property of expansion and relaxation, and the coiling, it causes lot of secretions, and excitement causes release of lubricating fluid from the Gartner gland. Okay, and this kind of gland is locked inside the vagina. Okay, and it causes moisturing and lubrication during the act of biological activities, and also it causes natural discharge, natural secretions it causes. And you know that this vagina is a harbor of lot of germs, and one of the major is lactobacillus. Okay, that lactobacillus is inside the vaginal canal, and it is a normal flora for the vagina, and it usually causes acidic media inside the vagina. Okay, and and there are other bacteria is inside. Those are usually the commensal organism. Okay, now this is fornix. Okay, posterior fornix, and this is anterior fornix. Okay, so now this vagina is posterior to the urethra. Look at here, this is urethra. And the vagina is anterior to the rectum. Look at here, vagina is posterior to the urethra and vagina is anterior to the rectum. Okay, so sonographically you can prove it. You can prove it. Okay, and vagina is inferior, so this is inferior, this is superior. Vagina is inferior. Okay, so now I will show you what can happen when there is an obstruction or diseases in the vagina. Let's show you. Okay, so this is normal vagina. And these are fornix. One on the anterior, one on the posterior. Posterior fornix is more deeper than the anterior. Okay? So this is normal. But if it happens like that, understand, there's a missing of the vagina, atresia in the middle part. As a result, what's going to happen? When this girl will be 12 years, 13 years, they will start having period. What's going to happen? All those blood will be collected over here and it not going to pass through this part because there is no connection over here. Okay, so this kind of atresia can be seen any part of the vaginal canal. Keep that in mind. So when there will be collection of fluid over here of the blood, we call it hematocolpos. Hematocolpos. We're going to discuss in the disease condition. Hematocolpos due to obstruction or atresia. Okay, so there might be another thing. What is that thing? There might be, let me show it here. There might be imperforated hymen. This is a hymen. Hymen is a membranous layer that has a central opening inside the vaginal canal close to the external orifice. Okay, usually it is intact, but when the girl is doing gymnastics, movement, swimming, playing, it can be cracked, ruptured, or it can be cracked during the first time sexual activities. Okay, it can be imperforated. There is no central opening. So as a result, what can happen? This girl is having period, and there's a blood, and the blood is trying to come down. Blood is coming, and after that blood cannot go down. Okay, the blood is there. This is blood. This is hymen imperforated. Imperforated hymen. Okay, so now it will be dilated. So vagina will be starting dilatations. And sonographically you will see anechoic inside. There will be collection of fluid. I am drawing the collection of fluid. Okay, and now it is every month there is a period and the blood is coming. Blood is coming and is getting more okay. Now look at here. It is getting more dilated. Sonographically, can I see this? Yes. We will see it sonographically. Okay. And this is called hematocolpos. Sonographically, how are we going to see it? Then you will see sonographically there is a fluid collection. Okay, this is the blood, completely anechoic. So this is hematocolpos. And when this is enough, it cannot expand anymore, then the blood will extend in through the cervix and the blood will go into the uterus and it will fill up the uterine cavity. So you will see the blood in the cervix, blood in the uterus. We call it hematometros. And when there's a blood all side in the vagina and in the uterus, in the cervix, all over the blood is there. In this situation we call it hematometrocolpos. Hematometrocolpos. So why is this happening? Because of the obstruction. Of what? Obstruction inside the vagina due to imperforation of the hymen or atresia or obstruction. Any growth can cause obstruction. As a result, the every month's period there is a blood cannot drain out through the vagina and it gets collected above the obstruction. As a result, it can happen. So we need to know the anatomy of the vagina. So then what is the functions of the vagina? Vaginal function, it participates in the sexual activities, and it also a receptacle for the semen discharge. It is also a passageway of menstrual blood out. Okay, so patient may come with all those symptoms. Simply, patient may have infection, vaginitis. Patient may have gonorrhea. Patient may have chlamydia. Patient may have other sexual diseases. Okay? Patient may have abscess. Patient may have polyp that can obstruct the passageway. Okay? So that's all for today. I gave you the anatomy and